with Dr. Benita Zahn.
As the COVID vaccine pipeline has begun to ease, who gets the product to the pharmacies? How is it stored? How do they get it to hard-to-reach communities? Well, that's where the Healthcare Distribution Alliance comes in. And Patrick Kelly, Executive Vice President of Government Affairs for HDA, is my guest. Hi, Patrick. Thanks for being with us.
Thanks for having me on.
Who knew there was such an organization? And I've got to wonder, what are you doing to move this vaccine as compared to, say, flu vaccine?
Well, actually, Benita, the only difference between this vaccine and the flu vaccine is the scale at which the rollout is occurring. And obviously, the pandemic has put a significant stress on the supply chain. We are working through that now with the manufacturers of the product, both Pfizer and Moderna. And we are also working with our central distribution network to get that product as soon as it's manufactured through the system out to the states so that it can be administered to the people who are in line to receive it.
Walk us through that. I think people don't realize. They think, well, Pfizer makes it and the feds step in and somehow miraculously get that stuff, directed, but Pfizer puts it on let's say, in a truck, and the feds say, here's the invoice, go there. There's an in-between step, right?
Well, so there are two different steps. So for the Pfizer product in particular, because it is a ultra-frozen product, Pfizer is handling a lot of the logistics transportation issues for their product. They are shipping their product directly from their Pfizer manufacturing facility to the FedEx and UPS distribution facilities, and FedEx and UPS are getting that product out to the broader supply chain. The Moderna product, the second vaccine that was approved, is moving from the Moderna facilities into one of our member companies, McKesson. McKesson is then taking the vaccines, adding the kits to them, which contain the syringes and all the personal protective equipment required. And then that product is being shipped out to the states, also through UPS and FedEx.
Now, I realize the feds are covering the cost for all this, but the fact that they have to make that intermediary step with HDA, does that incur an additional cost?
So technically it's with the companies that have been contracted. We're just the trade association that represents the pharmaceutical wholesale distribution segment of the supply chain. The contractual relationship with the federal government is with the distributor and or the third-party logistics providers, in this case, FedEx and UPS. They are contractually engaged with the federal government. They are being paid for their services by the federal government, and the federal government directs them where to ship the product and when to ship it.
So then, besides fixing up the packaging through McKesson, what is the role that your organization plays?
So, obviously so we're in phase one of this rollout, Benita, and as it expands and as it's going to expand in New York and across the country, we're going to see this product roll out to more facilities. It's not going to just be the mass vaccination sites or the hospital centers that are receiving the product. It's going to be the pharmacies, and it's going to be the pharmacies in the big urban areas as well as the pharmacies in the rural and underserved areas that are going to be receiving this product. Right now, we've got 35 member companies that are members of our organization, all standing ready to assist in this effort as this moves out. These pharmacies receive product from our members every day of the week. In normal times, they are getting shipments every single day from one of our members. And we are standing by and ready to utilize those sources and assist our pharmacy customers as they need it in this rollout. And when we're hoping that at some point we're there for that phone to ring if those pharmacies need help when they receive product from the federal government. We're there to help with that product. If they can't handle the volume of product they're getting, we can store it for them. If they need it shipped from one pharmacy to the next, we can assist in that, particularly because some of these things have to be maintained at such cold temperatures. We have the expertise to move that product.
So the people you deal with have that kind of refrigeration. And do you work with any kind of logistics software? We see that with school buses to make sure, they're routed well. Are you at that point?
Absolutely, Benita. That's literally the day-to-day operations of this industry are highly sophisticated. A lot of it is basically GPS-tracked facilities and trucks, all of it moving through very intricate information management systems. Every bit of it is tracked. All of the product is tracked. And we know where product is at every step along the way.
It sounds like somebody else wants your time. I hope I can there you go. I want to get one more question in. So, you know, look, on the ground level, folks have been very frustrated. They can't get their appointments. They're waiting a long time. They may have to travel long distances. Is that something that you folks are helping with? Or do you find, or are you finding the same kind of frustration? Do you feel the public's pain?
Well, absolutely, we feel the public's pain, and we're feeling the public's pain because the administration sites are feeling that pain, and they're the ones that are really experiencing the frustration firsthand. I have friends whose parents have been trying to get vaccines, finding it very difficult to just find some place to even sign up to get the vaccine, let alone get in the line at the facility or the pharmacy or the hospital or the NFL stadium to get the vaccine. So we are acutely aware of those concerns. We are fortunately, I think, as more vaccine comes online, where they're increasing the production of the existing vaccines. We have Johnson & Johnson, hopefully by the end of the month, coming online with their vaccine. 2 more companies in the queue to receive emergency use authorization from AstraZeneca and Novavax. And again, the volume and the supply should be able to meet the demand at some point. Now, on the back end of that, the administration process, getting the shots in the arms, that last inch issue, so to speak, will continue to be an issue. And I think some of it has to do with finding the number of people that are qualified to do it, finding the facilities that can accommodate those people. One of the big logistics challenges is once you get the shot, you've got to sit in a chair for 15 minutes and be monitored to make sure there's no adverse event. So having a small pharmacy in a rural area, you can give one vaccine to one person, they've got to sit in a chair, and then just the logistics of making that work. The other issue, and this is one of the more acute challenges we're hearing about now, and this is what we're talking to the government about, is the data entry component to this. Every person that gets a vaccine has to be recorded. In some cases, we were on the phone last week with another organization that tracks state health associations. They're saying they could administer vaccines at a clip of 2 to 3 vaccines per minute. But on the data entry side of the continuum, it's taking 3 to 5 minutes per vaccine to enter all that data into the systems that will then feed up to the federal government and the state registries to capture who got the vaccine, when they got it, where they got it, and what vaccine it was. Because if you get the Pfizer vaccine, you have to get the Pfizer booster. If you get the Moderna vaccine, the same. You have to get the Moderna booster. The Johnson & Johnson product is one vaccine, and that's, I think, going to expedite the process significantly.
A lot of choke spots along the way, and yes, you folks can move only as fast as the supply comes to you.
That's correct. And Benita, that supply is going out literally as quickly as it comes in. There's about a 24-hour turnaround from the point that product arrives at our facilities and the time it is going out the door to the various administration sites around the country.
Patrick Kelly with HDA, thanks so very much. It's fascinating, and it will continue to be in the weeks and months ahead, and perhaps we'll have an opportunity to touch back in and see how things are going as more vaccine rolls out. Thank you. Be well. And thank you for joining us for this edition of Health Beat, your health info on the go. And for all the information on the local vaccination clinics, check the link section right here at WNYT.com. Till next time.